Standard, and I met Joa, who's now the group editorial director at NMG, and he listened to me. And sometimes you just need that one person who's crazy enough to believe in your dream to open that door for you. So I remember sitting in his office, so he was asking me questions. So you're a doctor, but you want to do this and this, and I was like, yes. I think we can make health a bit more important differently, and I didn't know that was my interview. And so I had that was in 2016. So I'd been working for 4 years as a doctor. I remember at the time I was at the county. I even had a driver and a big car. But I told Joe, this work I'm even willing to do, to start as an intern, and you don't even need to pay me. And so that's how I started my career in journalism. And I usually say my successes in journalism have been because there's been a crisis. So in 2016 December, when I was just finishing the internship at Standard and people were figuring out what to do with me, Omar Oluga and team called for the 100-day strike, and I happened to be in the newsroom. So who was the other to-go-to person who had unfettered access to KMPDU, because these were my friends. I had inside, when you're in the newsroom, the one with the scoop is the one who really shines. So I had inside knowledge of what is happening, what the negotiations were, where people were hiding so that they're not seen. So I used to give, exclusive and very juicy stories and follow up. And so we were almost like at the front of reporting on the strike. We had accurate reporting. And I think the doctors also appreciated the kind of stories and news that we were doing. And so that's how I landed now a job, and I moved to Standard Group because people saw the value. And all of this time, by the way, I was doing that work for free. So I'm not saying people do for free, but sometimes you have to go an extra mile to prove that you can do this. And for me, I didn't mind it because at the time, no one else had done what I had done. I mean, there was no doctor in the newsroom, so nobody really knew. And for people to bet on you or take a risk on you, they have to be really sure that there will be some return on investment. And these are some of the things that you learn. Just because you're a doctor, you're brilliant, you've scored, maybe you're an A student, even in med school. I remember us guys used to be, we got to med school and we were okay with carbon chains because we realized at the end of the day, you are all doctors. So we were comfortable with carbon chains. But I'm not saying you'll be like that because we realized nobody asked, what did you score in med school? No, as long as you're a doctor and and you're ethical, things move. So we relaxed and we started doing AMSON things and union things and all of these other things. But that may not necessarily be for everyone. So you learn very quickly that the world does not owe you anything. And people look at you with that, they're looking at what is the return on investment. If I employ you, for example, at AR Hospital, what value are you going to bring to my hospital? Are you going to bring more clients or chase away clients? And that's some of the things that nobody tells you, but you learn it the hard way out there. So luckily for me, after that strike, people saw the value that I added to the newsroom. And so that's how I started my journey in the newsroom. The other crisis that helped me was COVID-19. It helped me in a way, but also helped me just rethink about the direction that I want my career to take. So COVID came, of course I was in the newsroom and we needed to put together a team that would go around and report on COVID, be up to date and all of those things. And so COVID accelerated for me the need for Standard Group to have a health and science desk. Before that, we were just like a bunch of us reporting on health. And so by the time I left, we had health and science desk. In I think 2021, 2022 financial year, we made, just as a desk for the group, about 100 million in revenue. And so people start seeing what health reporting can do. So that's from a business side. But from Mwananchi side, it was that we had content, we had information, we were available, we were around the clock, digital, radio, TV, newspaper, round the clock health reporting. My reporters, we exposed them to international trainings, we exposed them to people who had core knowledge of the sector that they were reporting in, and they really became good at it. So it's a win-win. And so when that happened, now for me it was about time to think about what's next. You've reported all of these things, but the healthcare sector still needs help. And so that's why I went back now to the hospital to see what do we do differently to change how we are offering help, to change how we are treating people, or to improve on how we are treating people. So as an advocate for healthcare, you don't need to be in clinical practice. I think that's one of the things that I've learned. You can be a lecturer where you impart knowledge on young people throughout their lives in med school, or you can go to pharma, for example. You can be in research, like what you have started now. You can be in public health, in the research world. There are many platforms that you can do that. You can be in journalism, like what I was doing, or you don't need to be mainstream journalism. You can do social media. For me, social media now is one of those key disruptors, I may say, in media, because you don't need a license, you don't need any permissions. Well, we may need to teach people some bit of ethics and how to be, how not to spread misinformation and disinformation. But I believe as medics here, your core training teaches you to be ethical. So if you're going to go to social media to teach people on certain issues, it could be on public health issues, it could be on, say, hypertension, diabetes, whatever it is, then you would know the right things to say so that you're not misinforming people. And one of the things you will learn, and it's one of the things I saw really rampant during COVID-19, somebody writes a whole paragraph of fake things and say, according to Dr. So-and-so, and people believed it. Especially those groups, Kina Mama, or Mama Kanisa, our aunties, they used to be very prevalent in those groups. So you get somebody sending you, this has been sent to this group. And so all the mamas in the village have believed all that story just because somebody said, according to Dr. So-and-so. So that title is really important once you get it, because it can either make or break. So if you're going to get into social media, and I'm seeing a lot of younger doctors getting into that, you have to remember that you have a key responsibility, not just to yourself, but to the whole, because you represent all of us. If you're going to misinform people, then people will be like, nyinyi madaktari mnatudanganyanga. So you remember that you have a responsibility, not just to yourself, but to the whole. When you're looking at research, for example, I was looking at some data, and I'm glad, Dr. you're here. Africa contributes about 2% of the research output. But when you look at the disease burden in Africa, I think we lose about 6 million people to communicable diseases. You're looking at acute respiratory diseases, HIV, malaria, TB, and some of the non-communicable diseases. So if you only have 2% of research being done, then it means there's a lot more for you to do to contribute to that. The only handicap, and I'm saying that's why it's good that Tari is here, is what we spend on research. We rely a lot on donor funding, who have their own agenda. It's about 1.3% for the whole of Africa. So that's just a drop in the ocean. So we need to do a lot in that field if you're going to make any difference for Africa. Why is this important? We're seeing our life expectancy obviously is improving just because livelihoods have improved despite the hard economy, as the MC said. changing lifestyles across all of us, what we eat, the lack of exercise or the exercising, poverty levels are still high in Africa. Even in an area like Nairobi, there's still places where people are, the urban poor. Not everyone is living comfortably. The issue of globalization, we saw what COVID did. Issues of medical tourism. We lose about $1 billion in a year for people going to India, for example, or other countries to seek healthcare. Why not be taken care of locally? We lose a lot when people are sick in terms of productivity. And in African setting, and I usually give this example, if the man of the house is unwell, then the woman is paralyzed in a way. If the children are unwell, it's the woman who's also paralyzed in a way. So it kind of stops that family for that period of time when somebody is away. And so we lose a lot of productivity within that time. So these are areas that yourselves as young people can venture into. The issues of non-communicable diseases, cardiovascular diseases, cancers, hypertension, diabetes. There's a lot of work to be done in these areas, and I think the onus is on you. We pass the baton to you to come up with new ideas, with ways, what Oji was talking about, of tackling some of these problems. I know probably you've heard we need African solutions for African problems, because most of the time somebody comes and prescribes something for us because they funded the research, but it may not necessarily work. But we live here, we've been born here, we've been raised here, we know where the pain points are, we know where the issues are, so we are able to look at where the problems are and offer solutions that work for us. There's a time I went to Turkana to do a story, and in one of those places, there was high maternal mortality. So people were asking why. So women were not coming to hospital to deliver. So what they decided to do was build a hospital not really state of the art, but a modern hospital facility with good hospital beds. It's a stone facility and it's really a good facility. But women still did not come until the day when they replicated mothers, let me call it a mother's shelter, to reflect the culture of the Turkana people, where you have a homestead with a main house, where now the woman could come into, made of, do I call them reeds? You know how those houses are done, not really anything fancy. And when they did that, women started coming to hospital. And even when they come, they prefer to be in that makeshift facility as opposed to this very modern facility, unless, of course, they need to go to theater. And it's changed. So you can imagine if somebody didn't think of providing a solution that matches the context of the people there, you'd still get high maternal mortality rates, and you're still wondering why, yet we've provided all of these fancy things. Yet people just need something that speaks to their culture, that speaks to who they are and what they find comfortable. So those are some of the things that we need to think about. What are some of the things that work for us that would improve healthcare? And these are low-cost, solutions. So you can imagine how much it costs to make a reed homestead, as opposed to building a whole very big superstructure. You would have saved a lot of more money, and the women would be comfortable because they would still get the skilled birth attendants, that midwives and nurses that would help them to deliver. So in conclusion, somebody was saying, you say in conclusion so that people turn up and they are alert. In conclusion, what is your role as medical students, as future medics who would be practicing? One, you have a responsibility to share your knowledge with your colleagues, with your patients, with your relatives, with everyone you know, because that information may be important to somebody at some point. It may not be at the moment you're sharing, but later on. So you have that one responsibility. The next one that I've learned through my different phases of career is to be available when you are called upon. Sometimes it may not pay you, sometimes you may be doing volunteer work, but show up, be that person who shows up. What Prof was saying, if all of you are distinction students and we need that, we have one slot, who do we choose? You'll probably go for the person who shows up, the person who's diligent, the person who's reliable, the person who's dependable. So these are some of the things that nobody teaches you. All of this academic information you learn and everything, theory, all that is important. But these other skills are what makes the difference. So for me, I summarize it as being available, go the extra mile. When you're called upon, sometimes you don't even need to be called upon, just volunteer and do something else. Then lastly, from my own story, do not limit yourself and your ability. Already as a medical student, you're top tier. I mean, I don't think there's anyone, okay, if there are others above medical students, I don't know. But for purposes of this conversation, you are the top. So you can actually do anything that you can think about. So don't limit yourself. You come to med school, you probably had talent in architecture, then you kill that talent. There's a urologist who wanted to do architecture. He actually did 1 year of architecture, then he dropped, then went to med school. Now he's doing his urology and enjoying it, and doing things in real estate. So you can mix those two things. So don't limit yourself and your talents and your other abilities just because you're a medical student. You never know, that's just because you're a medic, you never know where, there's an intersection between being a medic and your talent comes in. So always make sure that you don't drop that ball. Do not limit yourself. There's space for everyone. There's space for you in all of those other places where you didn't think there are. You could go into finance even after medical school. You could go into pharma and become a CEO somewhere even after medical school. So don't limit yourself just because you're a doctor. But if you also want to do clinical practice, you also don't limit yourself. You make sure you're the best doctor in that clinic, make sure you're the best doctor in that hospital who shows up for patients and for their colleagues, and you'll find that things will become easy and you'll enjoy what you do. It can be difficult at times, but if you know that you have a responsibility to share, you have a responsibility to be available, and you know that nothing can limit you, then you know that really you can do anything and excel while at it. Thank you very much, colleagues, for listening to me for the last half hour. I hope I have said something useful somewhere for you that you can carry on into practice. And I look forward to the conference, to interacting with you, seeing some of your presentations. And, I wish you all the best, and I hope to see you again next year during the conference and in other activities. I happen to be in KMA Circle as the Vice President, so I know I'll be interacting with you also now when you're talking about finance and money. So I wish you all the very best and that you enjoy the rest of the conference. God bless.
I think one of my takeaways has been that Africa has many problems and we need African solutions to African problems. So I believe we can find the intersection between our talent and our profession and provide solutions. Thank you so much, Dr. Korir, for blessing this occasion, and you have been blessed. Thank you.